In this video, I'm going to share expert strategies to predict the answers in the OET listening test before you even hear them. These strategies are guaranteed to help you boost your score. I'll go through each part of the OET listening test and explain exactly what to do in those crucial moments before the audio starts, so that you can give yourself the best possible chance of hearing the answer and getting the score that you need. Let's begin with Part A. In Part A, you're going to listen to 2 healthcare consultations, and you'll be listening out for specific information such as symptoms, test results, and duration of symptoms. Predicting the answers before you listen to the audio helps you pinpoint the specific details you need so you can avoid getting lost in unnecessary details. Let's go through step by step what you need to do in those moments before the audio starts. First, you should read through the notes and identify the headings, as this is going to help you predict what type of information you're going to listen to, whether it's information about medical history, symptoms, or treatment up until now. Next, for each gap, you should decide if it's going to be a noun, a verb, or an adjective that you're listening for. And you can usually guess this based on the words before and after the gap. Next, you can use the context of the notes to predict the type of word that's missing. If you're listening for a noun, it could be the name of a medical condition, a symptom, or perhaps a body part where the patient is experiencing pain. If you're listening for a verb, it could be an action that the patient needs to take, or an action that's already been taken. You might be listening for a number, which tells you the dosage of a medication, the duration of symptoms, or maybe a time frame. Next, consider common medical phrases that can help you predict the information. For example, if the words before the gap says patient is experiencing, you're most likely listening for some kind of symptom. If you see something like condition caused by, you're listening for a reason or a factor. If you see the word medication, you're probably going to be listening for the name of a drug or perhaps the dosage information. Finally, before you listen, be ready to hear synonyms and paraphrasing. Remember that it's very common in the OET listening test for the audio to use different words and phrasing to what you see in the notes. For example, if the notes say the word treatment, you might hear the following words in the audio: medication, therapy, or procedure. So when you're reading the notes and predicting what the answers might be, also predict how they might be worded in the audio, as this will give you a better chance of hearing them. Now let's take a look at some example Part A questions and practice predicting the answers. Here's an example question, and first we're going to look at the heading so that we know what the healthcare professional will be talking about with the patient. And here it says history of condition. Symptoms initially began. Okay, from the context of that note, we are most likely listening for a time when the symptoms started. So it's probably going to be a number. Let's take a look at the audio transcript, and the patient says, I'd say they started probably around 4 or so months ago. So our prediction was correct. It was a time or a start time for the symptoms, and that would be 4 months ago. The next heading says medication, so we already know before we even listen that they're going to be discussing medication. Currently takes, well, if they're talking about something the patient takes, that is going to be the name of a medication. And another one here. You can even start to guess based on your own medical knowledge what medications are prescribed to control anxiety, what medications are prescribed for seasonal allergies. So you can predict even further here. And if we go to the transcript, the patient mentions propranolol for anxiety and antihistamines for hay fever. So those are our answers for these questions. Now let's take a look at another example. We've got information given to the patient, symptoms suggestive of. Now the way that's worded based on the context of this conversation, we're most likely listening for a noun, which will be the name of a condition or an illness or disease. And number 12, something need to be conducted. Well, here we can start to think about common medical collocations. Usually when we see the word conducted, we're talking about tests. So here we're most likely listening out for the name of a type of test. And again, using your medical knowledge, you can even start to predict further to think what type of test you might hear. Let's now go to the transcript. For number 11, the doctor says your symptoms are consistent with type 2 diabetes. Note here the paraphrasing. The doctor doesn't actually use the same words as the notes. They don't say, your symptoms are suggestive of. They use a synonym. Your symptoms are consistent with. But we've got the name of our condition there, type 2 diabetes. And for number 12, I will need to run some blood tests. Again, the doctor doesn't say, I will need to conduct blood tests or blood tests will be conducted. They paraphrase that to run some blood tests. But we were correct, it is a type of test, so the answer for 12 is blood tests. Hopefully that successfully demonstrated how important it is to spend the time at the beginning of the listening test to go through and predict your answers. For listening part A, you really can use this time well to give yourself a head start. So make sure you go through the gaps, look at the headings, try to predict what type of word you're listening for. I promise it will make everything much easier. Now let's talk about part B. In part B, you're going to listen to common healthcare conversations such as briefings, handovers, or policy presentations. These are multiple choice questions. Now in part B, you're not actually going to be able to predict the answer because it's impossible to know what the answer will be until you listen to the audio. However, you can still use that time before it starts to think about what you're going to hear and prepare yourself to hear the answer. So let's go step by step and talk about what you should do. First, you need to consider who is speaking. You're always going to have a little context statement at the beginning of each question to say who is talking, who they're talking to, and what they're talking about. So think, who is speaking? If it's a nurse, they might be having a conversation with a patient. They might be handing over to a colleague. If it's a doctor, they might be explaining a new policy to a group of colleagues, or again, having a consultation with a patient. If it's an administrator, they might be giving a presentation or talking about workplace protocols. So it's important to first note who the speaker is and think about what they might typically discuss. Next, look at their reason for speaking. The context statement will say who they're talking to and what they're talking about. If they are doing a handover, you can expect to hear patient updates, perhaps some information about medication or maybe discharge plans. If it's a policy briefing, they might be talking about new protocols or safety guidelines. And of course, going through the answer options and thinking about what they each mean is also going to give you a heads up on what the content of the audio could be. Now finally, before you listen, it is important to again consider synonyms and paraphrasing. Remember, the audio won't necessarily use exactly the same words and phrases as you see in the answer options. So before the audio starts, go through each answer option and try to summarize it using your own words and consider how the speakers might say that particular idea in a different way. Once you've done that, you're ready to listen. Let's take a look at an example. Here is a part B question. First, we're going to read the context statement and ask ourselves who is speaking and what are they speaking about. We can see here that we're going to be listening to a conversation between two people, a charge nurse and a nurse, and they're talking about a patient in their care. Now we're prepared to listen. We have an idea of what they're talking about. Let's go through the answer options and be prepared for synonyms and paraphrasing. Option A, a synonym for worried could be concerned. And instead of saying the recurrence of bleeding, they might say the bleeding will return or come back. Option B, we've got the word loneliness. You can think about the other words in that same word family. So they might say feeling lonely rather than suffering from loneliness. And C, not stable enough to manage at home. Instead of manage, they might say the patient can't cope, and they might mention daily tasks at home. Now we've got an idea of some synonyms and paraphrasing. Let's go to the transcript. And here you can see the conversation between the charge nurse and the nurse. The nurse says, I think she's lonely. And you can see that there was some paraphrasing there, but our answer was option B. So that is how you can use prediction skills to give you a head start in part B of the listening test. Now let's take a look at part C. Many people consider part C to be the most challenging part of the listening test, and that is because the audios you listen to are longer and more complex. so it can be difficult to focus and hear the correct answers. But you still can use the same prediction strategies to help you. Let's go through it step by step. The first step when predicting answers in Part C is to have a look at the topic of the audio and consider what you already know about that topic. You can start thinking about vocabulary and phrases that you might hear the speakers say to get your mind into the correct place and be ready to listen. For example, if the topic of the audio is a new treatment, you might hear words like effectiveness, symptoms, patient response, or side effects. If you start thinking about vocabulary you might hear, this helps prepare you to listen. Next, you're going to go to the questions and make sure you understand what each question is asking you to do. Identify keywords in the question and really understand what it's asking you about. For example, does it want a specific detail from the audio? Is it asking about the speaker's opinion or attitude towards something? Next, go to the answer options. Think about how each option is different. Again, identify keywords, but remember, they might be paraphrased in the audio. So as with Part B and Part A, you're going to think of synonyms, paraphrasing. Summarize each answer option in your own words to get yourself ready to hear it expressed in a different way. Once you've done all those things, you're ready to listen. Let's have a go with an example Part C question. Here's our question then. So according to Dr. Hargreaves, when MRSA is found on the nose and skin, it is likely to. Okay, so the question says according to, which means we're listening for an opinion or a finding from this particular speaker. Now let's go through the answer options and think about how they might be expressed in the audio. Be harmless. The speaker might say it doesn't cause problems or doesn't cause issues. Lead to serious infections. Maybe they'll say it causes harmful infections, harmful being a synonym of serious. Be life-threatening. Another way of expressing this, they simply might say lead to death. Now let's go to the audio and see if we can find the answer. In the transcript, the speaker says, for most people, having this bacteria does not cause any problems. We can see then that this has been paraphrased. The answer is option A. It is likely to be harmless. And the speaker has said, for most people, having this bacteria does not cause any problems. So we correctly predicted how that might be worded in the audio, and therefore will have helped ourselves to listen for the correct answer. I hope that you can see then how predicting can even help you to get the correct answer in Part C, even if you don't know what the speaker's going to say. Now, predicting answers before you listen gives you a massive advantage in the OET exam, so don't waste that precious time before the audio starts and start practicing these strategies today. Now, if you want to continue learning expert tips and tricks for how to effectively pass your OET listening test, then I recommend that you check out this video next. See you next time.